So this is a quick overview of clinical psychology. If you want to take more, this is a career that will take you from a master's to a PhD or PsyD or EDD and basically work with people. It's a good 8-year commitment of college and graduate school, including an internship. But it's well worth it. So what is clinical psychology? Well, it's an integration of science, theory, and clinical knowledge for the purpose of understanding, preventing, and relieving psychologically based distress or dysfunction and to promote subjective well-being and personal development. In short, it's to help people feel better. Central to its practice are psychological assessment that is like testing, clinical formulations, typically using the medical model, and of course, a course of therapy, which for most psychologists includes talk therapy. Although clinical psychologists also engage in research, teaching, and consultation, they often do forensic testimony, which, by the way, involves anything with the legal system and program development and administration. In many countries, clinical psychology is regulated by the mental health profession. The field is generally considered to have begun in the late 1800s with the opening of the first psychological clinic at the University of Pennsylvania. In the first half of the 20th century, clinical psychology was focused on psychological assessment with little attention given to treatment. This changed after the 1940s when World War II resulted in the need for a large increase in the number of trained clinicians. Don't be fooled though, there was a need all along. It was just that technology and the academic people were there to actually provide some guidance on how to treat people. So far as back as Revolutionary War and the American Civil War and World War I, there was still a need for clinicians. It wasn't until World War II came along that things really changed. We talk a lot more about this in Abnormal Psych. It's like 2006 if you're interested. Since that time, 3 main educational models have developed in the United States. So the PhD, which is a clinical science model, focuses heavily on research. The PhD scientist practitioner model, which is integrated scientific research and practice, and the PsyD, the practitioner scholar model, focusing primarily on theory and practice. One thing that's not included in here is the EDD, which actually would be falling with the PhD scientist practitioner model. It's based on integrating research and practice. Clinical psychologists are experts in providing psychotherapy and generally train within 6 theoretical orientations, including the psychodynamic, which is more Freudian, which, truth be told, is pretty much gone. The humanistic model, which includes Carl Rogers, who we talk at length about in Abnormal Psych, providing both group and individual therapy, which we'll get into. The cognitive model, which includes helping people change how they think. The behavioral model, which includes helping people change what they do. And often there's a hybrid called the cognitive behavioral model, which focuses on both. The systemic or family model, which includes working with families and couples. And of course the medical model, which includes integrating both psychiatry and psychology together. Most people who see a therapist are involved in individual therapy where they meet for an hour, they have a treatment plan, they work on certain goals, and they make it work that way. Sometimes people are treated in group therapy, which might consist of 8 to 10 to 12 people, many with similar disorders. Sometimes it's a behavioral group model, sometimes it's cognitive, sometimes it's even psychodynamic. And the whole idea is that you give support for each other. The sessions tend to be longer, 90 minutes to 2 hours. And it's not advice giving as much as it is helping people who have, especially who have personality disorders, deal with other people. It also includes couple therapy, working with families to resolve marital problems, or for that matter, family therapy, A good example of that would be a type of therapy called structural family therapy that works with anorexic kids. So the whole idea is that you help the person deal with um, what's making them having an eating disorder. Sometimes it's family dynamics. And of course, the medical model, which we talked about in the previous section on health psychology, working directly with medical providers to help reduce clinical distress by focusing on health problems. And that's a quick overview.